what is Anderson disease? So we will look at the answers of these questions and learn a lot more in detail. So the first one is, we are just looking at the cycle as a whole. So firstly, this glucose, it gets to the glucose 6 phosphate, and this goes as the glucose 1 phosphate. And the disease involved here between the glucose and glucose 6 phosphate is nothing but the von Yerkes disease. So now in case of glucose 1 phosphate, the conversion happens. So the glucose 1 phosphate to the UDP glucose. Next, the UDP glucose is converted to the amylopectin. Then this gets converted to the glycogen, and after the glycogen it gets converted to the limit dextrin, and then it again joins the glucose 1 phosphate. Now jumping a bit in detail. So here we saw that the glucose 1 phosphate is converted to the UDP glucose. So the enzyme involved here is the UDP glucose pyrophosphorylase. Next is in case of the UDP glucose. So there is the UDP glucose getting converted to the amylopectin. So this happens in place of a particular enzyme, that is the glycogen synthase. Next, the amylopectin was being converted to the glycogen. So this is in presence of the branching enzyme. So then we have the glycogen. So there is another step where the glycogen is converted to the glucose, and here the disease which is involved is nothing but the Pompe's disease. The Pompe's disease, and here what happens is there is the lysosomal degradation, and then we have the glycogen. So the amylopectin was converted to the glycogen. So the glycogen was being converted to the limit dextrin. So in this step, the disease is McArdle's disease, and the enzyme, if you see, it is nothing but the glycogen phosphorylase. Next, we look at in case of the limit dextrin. So the limit dextrin is being converted to the glucose 1 phosphate. So this was in presence of this. The disease involved here is the Cory's disease, and the enzyme here is the debranching enzyme. So now going on to the diseases. So the first one is the GSD type 0. So the GSD type 0, the enzyme defect here is nothing but the glycogen synthase. So what are the symptoms? The symptoms is nothing but there is hypoglycemia as well as the presence of early death. Next is the GSD, that's the glycogen storage disorder 1A. So this is nothing but the von Yerkes disease. So what is the enzyme defect here? Enzyme defect here is nothing but the glucose 6 phosphatase. So von Gierke's disease, what are the symptoms? So the enzyme defect was the glucose 6 phosphatase. And what is the symptoms? Symptoms, it involves, there is the hepatomegaly. Then there is also the renomegaly. This is due to the glycogen accumulation. Next, we look at the severe. There is severe fasting hypoglycemia. There is also the growth failure, lactic acidosis, hyperuricemia as well as hyperlipidemia. Next we look at the GSD, that is a type 1b. So here the enzyme is the endoplasmic reticulum, the glucose 6 phosphate transporter. So this is the enzyme defect. So the symptoms, it is similar to the von Gierke's disease. So it's very similar to the von Gierke's disease. That is, there can be presence of the hepatomegaly, there can be presence of the renomegaly. There is a glycogen accumulation. Due to the glycogen accumulation, there is hepatomegaly and the renomegaly. And next there is also the severe fasting hypoglycemia. Next there is also the growth failure, lactic acidosis as well as the hyperuricemia and the hyperlipidemia. And other thing to note is that there can be infections. So what is it? It is nothing but the recurrent infections. And why are the recurrent infections occurring? It may be due to, or is mainly due to, the impaired neutrophil function. Next we move on to the GSD type 2. So GSD type 2 is nothing but the Pompey's disease. So here the enzyme defect is nothing but the lysosomal A alpha 1 4 as well as 1,6 glucosidase. So this is the acid maltase. So here the symptoms being, there is muscle weakness. Next there is also death. There is death by age. So this is in about 2 years there is death, and this is nothing but the infant variant. Next there can also be the cardiomegaly as well as the heart failure. Next we move on to the GSD type 3. So here what is involved is this is nothing but the Cory's as well as the Forbes disease. The Cory's or the Forbes disease, and this is the limit dextrinosis. So the enzyme defect here is nothing but the glycogen debranching enzyme. And what is the features of the Cory's and Forbes disease? The symptoms, it involves the muscle weakness. Next the fasting hypoglycemia, as well as then there is the hepatomegaly. And why is the hepatomegaly occurring? It is due to the accumulation. So this is accumulation of the branched chain polysaccharide, that is the limit dextrins. Then there is also presence of the growth retardation as well as a normal lactic as well as uric acid levels. Next, we look at the GSD type 4. So this involves this is the Anderson disease. So in case of the Anderson's disease, the branching enzyme defect is there is a glycogen. There's glycogen branching enzyme. And what are the symptoms? The symptoms it involves, there is a failure to thrive. There is also the hepatomegaly, and this is nothing but due to the accumulation of the polysaccharides, and this is with a few branch points. Next, there is also death. So death can occur. This is about 5 years death can occur. Next, jumping on to the GSD. So this is the GSD 5. So in case of GSD 5, it is nothing but the McArdle. The McArdle's disease. So what is the enzyme defect? It is the muscle glycogen. Muscle glycogen phosphorylase. So what are the symptoms of this McArdle's disease? It is nothing but the exercise. There is exercise induced cramps. Then there is also a renal failure. So why is the renal failure occurring? Renal failure can occur due to the rhabdomyolysis and the myoglobinuria, as well as there is the second wind phenomenon. Then we look at the GSD, the GSD type 6. GSD type 6 is nothing but the Her's disease, and the enzyme is the liver glycogen phosphorylase. So what are the symptoms? The features, it is generally benign. There is presence of the mild, what is it? Mild hypoglycemia, as well as a hepatomegaly. Then what we look at is the GSD type 7. So GSD type 7, it includes the Torrey's disease. So the enzyme here, the enzyme defect here is nothing but the muscle phosphofructokinase. So what are the features, the symptoms of this? The clinical features of the Torrey's disease is nothing but the exercise induced muscle cramps. Exercise induced muscle cramps as well as the weakness. Then there is also the growth retardation as well as the hemolytic anemia. So now, answering the questions we had initially asked. So what is the von Guericke's disease? This was the first question. So it is nothing but the GSD type 1A. The enzyme involved here is nothing but the glucose 6 phosphatase. Now looking at the clinical features, it includes the hepatomegaly. There is also the renomegaly. So all this is due to the glycogen accumulation. There is also severe fasting hypoglycemia. Next, there is also the growth. There's growth failure, lactic acidosis, there's hyperuricemia as well as the hyperuricemia. lipidemia. The next question we asked was, what is the Pompey's disease? So the Pompey's disease is nothing but the GSD type 2. So the enzyme involved here is nothing but the lysosomal alpha 1 4 and 1 6 glucosidase. This is nothing but the acid maltase. So what is the symptoms, the signs? It involves the muscle weakness. Next, there is death. There is death, and this is by age. By age of 2 years, there is death. There is nothing but the infantile variant. Then comes the cardiomegaly as well as the heart failure. The last question we asked was, what is the Anderson's disease? So the Anderson's disease is nothing but the GSD type 4, and here the defect lies in the glycogen branching enzyme. And what are the features? It includes, there is failure to thrive. Next is, there is presence of hepatomegaly. And why is this? This is due to the accumulation. There's increase in accumulation of the polysaccharides. This is with the few branching points. Then comes, there is death. So there may be death, and this is at the age of 5 years, there may be death as well. The topic today is the glycogen storage diseases. So the questions being, what happens in case of the glycogen 6 phosphatase deficiency? Next question is, what is the Pompey's disease? Next is,
hello everyone, this is Dr. Hub. Now let me tell you our story. Running with us, we are sure you will reach your destination with ease.